We are live, sir.
Thank you. I'd like to welcome everybody to this special meeting of the governing body, our first of the new year and our first with the new members of the council. Welcome and congratulations. And to everybody who is rejoining us, Happy New Year. It's for the record, it's 4:05 by my clock. And we'll begin with the Pledge of Allegiance led by Councilor Rivera. Salute to the New Mexico flag led by Councilwoman Villarreal. Invocation, Councilor Cassett. And then if anyone has a remembrance they'd like to share, we'll take that at that time before we go to the regular order of business. So please stand for those different pledges.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I salute the flag of the state of New Mexico and the Zia symbol of perfect friendship among united cultures.
Thank you so much, everyone. I'm very excited to be with everyone here in the new year. And as we start with our very first meeting with our new governing body, I just ask God or whatever higher power that you believe in, or whatever spirituality you believe in, to help guide us through this year in making good decisions, in working together, in working out our differences in a way that can be collaborative and productive to make sure that we are serving our constituents, our city, and our community to the best of our ability. Thank you.
Thank you, Councilor. Are there remembrances? Anybody on the governing body would like to use this time to call to mind? Just raise your hand, I'll call on you. If not, I would just ask us all to take a moment to think of the people who are struggling with or have been afflicted by COVID or other challenges during this holiday season as we begin a new year. Hope for a year of health and safety and well-being for everybody in our lives and in our community. So let's take a minute for that. Thank you very much, everybody. So let's begin with the roll call then, Geraldine.
Yes, sir. Mayor Weber,
Present.
Councilor Cassett,
Here.
Councilor Chavez,
Here.
Councilor Lee Garcia,
Here.
Councilor Michael Garcia,
Present.
Councilor Lindell,
Here.
Councilor Rivera,
Here.
Councilor Romero Worth,
I'm here.
and Councilwoman Villarreal.
Present.
You have a quorum, Mayor.
Thank you very much. Can I get a motion to approve the agenda, please?
Move to approve.
Second.
We have a motion to approve the agenda and a second. Is there any discussion? If not, could you please call the roll again?
Yes, sir. Councilor Cassett,
Yes.
Councilor Chavez,
Yes.
Councilor Lee Garcia,
Yes.
Councilor Michael Garcia,
Yes.
Councilor Lindell,
Yes.
Councilor Rivera,
Yes.
Councilor Romero Worth,
Yes.
Councilwoman Villarreal,
Yes.
and Mayor Weber.
Yes.
Motion passed.
Thank you very much. Item number 7 on our agenda for anyone who is watching or listening at home. We have 3 appointments that are the work of item number 7. First is the appointment of Councilor Signe Lindell as the Mayor Pro Tem, and that requires a vote of the governing body.
Move to approve.
Second.
There's a motion to approve that appointment. Is there discussion? If not, could the please call the roll? I was going to say, could the clerk please call the roll? Could our clerk substitute please call the roll?
Yes, sir. Okay, Counselor Chavez,
Yes.
Counselor Lee Garcia,
Yes.
Counselor Michael Garcia,
Yes.
Counselor Lindell,
Yes.
Counselor Rivera,
Yes.
Counselor Romero Worth,
Yes.
Councilwoman Villarreal,
Yes.
Mayor Weber,
Yes.
Counselor Cassidy.
Yes.
Motion pass.
Very good. And according to my notes, the announcement of the appointment of Councilor Romero Worth as our parliamentarian does not require a vote, but is worth noting since we turn to the parliamentarian for guidance on a number of issues of the processes that govern the governing body meetings. But there is the appointment of Councilor Romero Worth to continue to be our parliamentarian, no vote required. And then there are the appointments of council members to different committees and assignments. That is the other order of business under appointments. That does
Move to
require.
approve.
There's a motion to approve from Councilor Michael Garcia. Is there a second?
Second.
I heard Councilor Cassett with the second. Is there discussion? I see Councilwoman Villarreal's hand is up.
Thank you, Mr. Mayor. Just a quick clarification. You and I had talked about this earlier. It was about the Santa Fe Extraterritorial Land Use Authority. Did we determine that that was going to be revived, or what was the status of that?
I got some good information on it from our city attorney's office. I'll tell you what I was told. Maybe Aaron would like to weigh in as well. From the information I was given, it's never been formally disbanded, but it hasn't been meeting. It's there as a resource should there be issues that come up regarding boundaries, but it has not been meeting for some time. So I likened it to maybe inappropriately, but to an appendix. It's there, but it's not functioning at the moment. It just hasn't been extracted.
Thanks for that information. The other thing I was wondering is, would that entity then be utilized for any discussions around the annexation?
It under certain circumstances, it would be. I think this question has come up before. What happened with the discussion that was initiated by Commissioner Hanson around the current annexation was that she had taken the initiative to suggest that 2 county commissioners, 2 city councilors would sit down and talk it through rather than referring it to this particular body, which is why it is structured the way it is, as I understand it. Although the city attorney's hand is up, she may be able to weigh in with better intelligence than I've got.
Mayor Weber, Councilwoman Villarreal, happy New Year to everybody. It's good to see you. I think it will depend a little bit on what the outcome of those negotiations are, whether or not this group would need to meet and under what set of recommendations. So at this point, it's not required to meet, but whether or not it will be, I think is somewhat to be determined. So if we need this group, it would be probably nice to have it established already.
Okay, that's helpful. Thank you.
Very good.
I think the other question I had was just to make sure everything is consistent. The only position or committee I didn't see as listed as chair was the Public Safety Committee for Council Rivera. I don't know if we need to add that, because I believe he is the chair of Public Safety Committee for now. At this time, I should say.
I believe that's correct. And that
Mayor
would,
Weber, Councilor Villarreal, if someone's already been appointed chair, then they would continue serving until there's a change. So if he's already been appointed as chair, then he can continue in that capacity.
Okay, that's all I have. Thank you.
duly noted. Thank you for the clarification. And there's a picture of Councilor Lindell. Hi, Councilor Lindell. Welcome back. Any other questions about these appointments at this time? If not, could the clerk or the clerk's assistant call the roll, please?
Yes, Mayor. Okay, Counselor Lee Garcia,
Yes.
Counselor Michael Garcia,
Yes.
Counselor Lindell,
Yes.
Counselor Rivera,
Yes.
Counselor Romero Worth,
Yes.
Councilwoman Villarreal,
Yes.
Mayor Weber,
Yes,
Counselor Cassett,
Yes.
and Counselor Chavez.
Yes.
Motion passes.
thank you.
You're welcome.
If you could read us item number 8A, and then we'll turn it over to the HR director, but maybe you could read the item so the public can hear it in its full.
Yes, sir. Item 8A is consideration of a resolution temporarily modifying the city's personnel rules regarding administrative leave to provide a standard framework for issuing COVID-19 administrative leave.
And
For-
Bern, are you going to take this up for us, please?
Yes, thank you, Mr. Mayor. I first want to apologize that this wasn't uploaded as timely as we all would have liked to have seen it uploaded. And so I apologize for that. So I will start by providing a little bit of background as to why we're recommending this temporary modification of our rules. Essentially, right now, when we have employees who are identified as a close contact or testing positive for COVID, we go through a process to allow for administrative leave with pay for these employees. We did a rule change back in March of 2020. And as we all know, this thing, everything changes with COVID. And so we would like to propose a temporary change to our rules and regulations that would allow for employees to have access to administrative leave with pay if they either test positive and are unable to telework, or they are close contact and are unable to telework in a more user-friendly way. So what happens right now is they have to fill out a form and request that with the city manager. So what we're proposing with this temporary change for calendar year 2022 is to put the number of hours identified in the resolution, depending on the type of employee that you are. And then if employees are identified as needing that leave, they will have access to it immediately instead of having to fill out the paperwork, request the leave from the city manager, then report it to payroll. It would all be done seamlessly if this was approved. And I think it's user-friendly for employees, and it's more streamlined for the supervisors, for payroll, for HR, and employees know that they have access to this leave at the onset. So I think that's the most important thing. It's similar to the way we enacted the Families First Coronavirus Response Act leave. So it would be 80 hours for regular full-time employees, 40 hours for part-time employees, and then 96 hours for firefighters who work the shift schedule. So that is the reason for this, and it'll be for calendar year 2022. And then, of course, if we need to make any adjustments or modifications, we would definitely come to before the governing body if we needed to request any additional changes.
Thank you, Bern. Any questions about the purposes for this or how it will be functionally implemented? Let's see, we got a bunch of hands up. Let's start with Councilwoman Villarreal, then Councilor Cassett, Romero Worth, and Lindell, and Councilor Lee Garcia.
Thank you, Mr. Mayor. I felt like I didn't have enough time to really dig in since it was right before the meeting we got the information. So I just wanted to clarify. So this administrative leave, we're changing the process. It sounds like more of like a streamlined process with a form versus being signed off by the city manager. So maybe you could answer that first, and then I have a few other questions.
Mr. Mayor, Councilor Villarreal, yes, that's correct. Under the current policy, also it allows for 5 days. I know the quarantine period is potentially changing for this state of New Mexico. The CDC has already recommended that change, but we felt like the 80 hours for regular employees would allow for additional access in the event that someone either gets it twice or is exposed, more than once. So it is changing the process, but it is also, depending on how the rules change for quarantine periods, might be a little more leave for employees if they need to access it.
Okay. And then this leave that is being adjusted is accessible to both vaccinated and unvaccinated employees?
Mr. Mayor, Councilor Villarreal, yes, it is.
Did we calculate how much administrative leave was used in 2021 for this purpose?
Mr. Mayor, Councilor Villarreal, I don't have that number right now, but we can certainly run some reports and get that for you.
I think it would just be helpful to see how many people utilized it. And I'm assuming it was not just, well, if they were sick, they had access to it. Did they also have access to it last year if a family member was sick too?
Mr. Mayor, Councilor Villarreal, it's if someone tests positive, if an employee tests positive, or if they're a close contact.
Okay. But not leave for a family member that may be sick, correct? Okay. All right. I guess what I'm wanting to know more about is what would be the incentive for employees to get vaccinated and boosted with this change? And the reason why I asked that is because I was looking at the fire department leave, which is 96 hours compared to other full-time employees, which was only 80. Yet the numbers in that department have been the highest in terms of testing positive. And I don't know if we know the details about vaccinated versus unvaccinated, but I'm just curious, what would be the incentive to get vaccinated if we're also providing administrative leave? I know there's some things that are that are hard to determine because COVID it's unpredictable, but I guess I just wanted to understand that more, if you could speak to that.
Mr. Mayor, Councilor Villarreal, that's a really good question. So the 96 hours, let me just start by saying the 96 hours does cover a 10-day quarantine period for their particular schedule, as does the 80 hours for a regular employee and then 40 for a part-time. If someone is, the way that the rules are right now for the city, if someone is not fully vaccinated and they're exposed, they have to continue to be out on leave. So they will have access, if we're talking about a firefighter, for example, they will have access to 96 hours if this is approved. If they continue to be a close contact, after that 96 hours is exhausted, then they will be on their own leave. But they will still be required, the way the rules are right now, to quarantine.
Yeah, I understand that. I guess I'm just trying to understand what's the incentive for our employees to get vaccinated, given that we do have administrative leave for them if they do get sick, which I think is important. I'm just trying to see the correlation between incentivizing and supporting our staff in that effort. So I don't know if you all have any information or details about or have thought about that.
We have, and this has been a really delicate topic because we want to encourage our employees to get vaccinated. We have had these discussions to ensure that we're also complying with employment laws to not treat any particular group of employees differently. And so that's been something that we've been trying to balance as we put forward some of these requests for changes. So that has been discussed, Counselor, and I think it's a really good question. And it is a tough balance to have. You know, what do we do here to ensure that we're not violating anybody's rights, not providing additional benefits for different beliefs? And so that's been somewhat of a challenge to try to balance that out.
I understand. I'll yield the floor since our whole team has questions.
Yeah, there's
Thank
a
you.
lot of hands that are up. Before we get to Counselor Cassett, Bernadette, you did not speak to one question that we ought to have on the table, which is what happens if we don't, what happens if this resolution is not approved? What is the current process that would be continued?
Mr. Mayor, the current process would be that employees would fill out the form, request the leave from the city manager, and they would be done one by one. So it would be a very manual process. Some could get missed. If someone's really sick and unable to complete the form, they may miss out on the benefit. So there could be some issues there. This would, again, just be a more streamlined process. We would still be issuing out the administrative leave. We're just trying to make it more efficient.
Thank you. Counselor Cassett, you have the floor.
Thank you very much, Mr. Mayor. I just wanted to piggyback off of the conversation that Councilwoman Villarreal was bringing up regarding that challenge of, wanting to make sure that we are incentivizing, encouraging staff to do everything that is in their power to prevent the spread of this disease. I think the other side of that coin is that we also need to incentivize them to stay home so that they don't spread it to other people. So it is a challenging balance. And so I wanted to make sure that we were thinking about that too. I also would love to see the amount of leave that was used in 2021 and specifically how that broke down by person. And if there was anybody who potentially needed more than 80 hours. So for example, if they got sick themselves and then they were exposed and had to quarantine, I would just be really curious to see how this all broke down, how much has been used. And if there was anybody that was potentially left in a situation where they were not able to work because of COVID and also were not able to receive pay. So whenever we could get that information, I would greatly appreciate it. Just to clarify, so Councilwoman Villarreal asked about if this leave would cover taking care of a family member. I do believe that if there is a parent that there's a school closure, that this will cover them having to stay home for that if they are unable to work from home. Is that correct?
Mr. Mayor, Councilor Cassett, the modification to the sick leave policy would allow employees to utilize their sick leave to address this particular matter. So if the school closed down and the parent had to stay home, our current policy that was adopted in March of 2020 allowed the flexibility of the sick leave to be used for this purpose, whereas before March of 2020, it did not allow for that.
So the sick leave can be used, but the COVID admin leave can only be used if they themselves have tested positive or have to quarantine.
Correct.
Okay, thank you for clarifying that for me. And just, I think that there's a little typo on page 1, line 22. It says to care for a household member whose school or daytime is canceled. I'm going to guess that should be daycare because daytime keeps happening even with COVID. So just a quick note there. I think those are all my questions right now. Without the information about what the admin leave really looked like last year, I think that's really important to have for us to be able to analyze that. And as you mentioned, some of the quarantine policies are going to potentially be changing. So we may have to have some more flexibility with this as well. I'm sorry. So they do have to So it's streamlined. They automatically have this. Is there a form that needs to be filled out in order to, do they have to prove that they've been a close contact or that they have tested positive? Do they have to submit a positive test?
Mr. Mayor, Councilor Cassett, what we would do is we would work, HR and payroll would work collaboratively, outside of the request process. It would automatically populate in their leave accrual balance. And then bi-weekly, HR and payroll work on numerous reports. This would be an additional report to say employee X has access to, 30 hours of COVID admin leave for this pay period. And then the only thing the employee would need to do is fill it out on their time record saying that they are submitting for 30 hours of COVID admin leave. So it just streamlines that process for the employee.
Okay. And if we, hopefully not, but happen to still be in this position in 2023, this does not carry over, but they would start with, assuming we don't change anything, they would start with an additional 80 hours, or they'd start with just the standard 80 hours next year.
Mr. Mayor, Councilor Cassett, my recommendation would be that we would analyze this as we are with our cases monthly, and then we would bring forward a new change for calendar year 2023.
Okay, but at this moment, staff should not expect to have this, that should not be an expectation that they would have this rollover if we do not change anything.
Correct.
Okay. Okay, I believe those are all my questions at the moment. Thank you.
Thank you. Councilor Romero-Worth, you have the floor.
Thank you, Mayor. And just to pick up where Councilwoman Cassett left off. So it doesn't, if you don't use it, it doesn't roll to the next year. But if we don't change this policy, do we have to renew the resolution again in 2023 in order to give people a new, to set the clock again and have the 80 hours start fresh in a new year, if assuming this pandemic's going to go on a couple more years?
Mr. Mayor, Councilor Romero-Worth, yes, we would bring forth the new resolution.
Okay, and it doesn't really say in here that this is a one-time 80 hours. What happens if you use up your 80 hours? Let's say you get COVID more than once. What happens? Do you get another? I mean, are we intending that this is one-time 80 hours and that we should, I don't know. I do know of people who have been infected more than once. So what happens if that happens and you've used your 80 hours of admin?
Mr. Mayor, Councilor Romero-Worth, the intent of this is to have it be a one-time for calendar year 2022. And this is, this admin leave, if approved, would be granted regardless of accrued hours of sick or annual leave by any employee. So in the event that someone needed more than 80 hours for a regular full-time employee, they could utilize any other paid leave that they have in their accrued balances.
I'm sorry, either you or I cut out. They could use their accrued sick leave. Is that what you were saying?
Sick leave or annual leave, yes.
Okay, and I guess I only wonder whether this should say that it's a one-time 80 hours for this calendar year. It does say all full-time employees shall receive 80 hours of COVID administrative leave. Part-time shall receive 40, 96 hours for fire department shift employees to use during the calendar year. I don't know. I mean, maybe I defer to the city attorney. Should it say a one-time roughly 80 hours, or is that, I don't know, just throwing it out.
However, Councilor Villarreal, the last clause in that paragraph, the last sentence talks about how it's
Only
forfeiture
available.
and only available during calendar year 2022. Yeah, so the intent there, if there's any concern about it not being clear, we could add to that, but the intent is that it's 80 hours and that all employees are given the same opportunity to get it, but certainly if someone is unvaccinated, they're much more likely to run out.
Yeah, I guess I'd be interested in exploring something that says a one-time, I don't even know how you do it. I don't know. Something that says that it's one time. Okay, and then I guess the other question is, I'd be interested to know, when you compile the data, how many people have used administrative leave more than once? Like, when, have they gotten sick and they've used all 80 in one infection, or have they had to come back and dip again because they got COVID again? Or I guess that would be the only instance, right? Because you can only use admin leave if you yourself are sick, correct?
Mr. Mayor,
No.
Counselor, yeah, we can get you that data.
Yeah, so it'd just be interesting to know. Yeah, and I mean, how did you come up with 80 hours? Or is that where people, that's the sweet spot? How did you determine that?
Mr. Mayor, Councilor Romero-Worth, this was drafted and feedback was provided before the CDC issued their new guidance on quarantine periods. So this would carry someone for one quarantine period under the previous CDC guidelines, and the same for firefighters, the 96. So
Okay.
so that's where that number came from.
Okay, thanks for kind of drawing a line under that. That's very helpful. And then I guess my only other question is, if I don't know how other counselors will feel about adopting this before we have the additional data, but if we were not to pass this until the 12th, what is that? What's the downside of that to the operation of the city?
Mr. Mayor, Councilor Romero-Worth, it's a lot of paperwork that employees have to fill out. We go back and forth with the supervisors. It's really challenging for payroll because there's not a lot of time, like especially depending on when someone tests positive or is aware that they were a close contact. We're running up against the clock with payroll deadlines. So it makes it really difficult administratively to get them processed, and sometimes it could result in an employee not receiving the hours timely for that particular pay period. So we're trying to minimize those situations that happen.
Okay, and then just one other question. I mean, do we, in order to get this administrative leave, do you see some sort of documentation that there was a positive COVID test?
Mr. Mayor, Councilor Romero-Worth, yes, HR is the department that makes contact with all employees. So we go through a series of questions, and that's how we would develop our report that we would say, for this pay period payroll, here are all the employees who are approved access to the COVID administrative leave. So it would be it would be done in that manner.
Okay, thank you, Mayor. That's all I have.
Thank you. Councilor Lee Garcia, you have the floor.
Thank you, Mr. Mayor. I basically, a lot of my questions were answered during the previous comments, and I just kind of want a little bit more clarification in regards to this current proposal is being done similar to one that was to last calendar year. Is that correct? Or there has not been one?
Vern, you're muted.
Sorry, I thought I took it off. Can you hear me? Okay. Mr. Mayor, Councilor Lee Garcia, we did have a change to our policy in March of 2020 that provided some administrative leave to our employees. We're just trying to streamline it and give them a balance now that they would have access to it directly instead of completing a form and having that form go through an approval process before they can access it. So there was a mechanism by which they could have administrative leave. It was just the processing just looked a little different.
Thank you. And I guess my other question would be in regards to the funding for this. It comes out of, where does it come from? Obviously, it's not coming out of the employees' sick leave or regular leave time. So where does the funding come for this?
Mr. Mayor, Councilor Lee Garcia, that's a good question. So for employees who are in positions that don't require filling a post, so if someone is out sick and their post doesn't require someone else to fill it in, of course, their positions are already budgeted. We're just not having any work produced while they're on leave. So technically it's already budgeted and comes out of the budget from where they're paid. If it is a post position, primarily firefighters who, if they're on leave, we need somebody else to fill in, or police officers, then it would be, that time is already budgeted, but the overtime cost would be an increase, and it would come out of whatever fund that they are originally paid out of.
Thank you. And then I guess just the last, not question, but a comment. I just also would go back to the vaccinated versus unvaccinated and be careful on how we administer that, just to not discriminate against someone who has chosen not to be vaccinated. So that would be my last comment. Thank you very much. I'll yield the floor.
Thank you, Counselor. Counselor Lindell, you have the floor.
Thank you, Mayor. I can see why this has come forward, but I'm not at all comfortable with how it is at this point in time. And to approve it for a year is not comfortable for me, maybe for 6 months at a time. But even since this was put together, I think that the CDC has changed their quarantine time. I don't want to commit to this for a year. I also want to have an opportunity to look at more data with it. And I also want to motivate people to get vaccinated. We talk about it and we talk about it and we talk about it. I think we should take a look at through HR and through legal. Doing this as a more complete package and trying to motivate people to get vaccinated. And I realize that it has some immediacy, but I think that we have a council meeting on the 12th. I think we could go 9 more days, another week, and try to get more information together. The way this stands right now, I don't have much comfort level with it. So let's see what the council wants to do with it. But I think everything that's been brought up is a good point. I appreciate Councilor Villarreal joining me and wanting to motivate people to get vaccinated. And if this needs some more work to find the proper path for that, let's take another week. So that's where I am with it. Thank you, Mayor.
Thank you, Counselor. Counselor Rivera, you have the floor.
Thank you, Mr. Mayor. Ms. Salazar, so this is based on current CDC guidelines, right? Which calls for 5-day, I think, quarantine, whether you have it or whether you have exposure to it.
Mr. Mayor, Councilor Rivera, this is based on the previous guidelines where it's a 10-day quarantine if you test positive, and then if you're a close contact who's not vaccinated.
But even now with the 80 hours for regular employees, it would still cover 2 exposures, correct? Based on the current guidelines?
Mr. Mayor, Councilor Rivera, yes, based on the current CDC guidelines, it would cover 2 exposures. So if we were to evaluate this for 6 months, perhaps we can cut the hours in half, especially in light of the new CDC guidelines, and revisit it maybe like in June. Maybe that provides a little more comfort level for everyone. And then we will continue to provide some statistics on leave throughout that time frame and cases, percentages of vaccinated versus unvaccinated, all those data points for you all to review. So that's something that we can look at as well if need be.
All right, and the difference in hours for firefighters is because if they receive an exposure at the start of the week, they work a 48-hour schedule. So the first 48 would cover 1 week. And then if they were exposed a second time, they would need another 48 hours to cover a second full week. Is that correct?
Mr. Mayor, Council Rivera, yes, the idea was that we would treat them exactly how we would a regular employee and cover that full quarantine period.
So the hours, the quarantine period or the time frame is the same, but the hours are different simply because of the schedule they work.
Yes, because firefighters essentially work more hours in a week than regular employees, so it's comparable based on their schedules. Yes.
Do you know if the fire department staff are keeping statistics on exposure, whether known or unknown? Because they get called to every sick call, and sometimes they know the patient has COVID and sometimes they don't. And maybe later.
I don't know the answer to that, but I can certainly talk with the Chief Moya to see if they are keeping stats on that.
And I heard recently that, do we still have a COVID ambulance that responds specifically to those types of emergencies?
Mr. Mayor, Councilor Rivera, I don't know if they still have that going, but I will add that to the list of my questions for Chief Moya and get back to you all.
All right, and then also I know that they reported that we've been doing more transfers from the airport to the hospital, specifically for COVID patients that are coming from other parts of the state, or even in some cases from other states, because we have availability here at Christus, I guess, is taking most of them. So just curious as to those stats as well, how much the transfers from the airport to either one of the hospitals here has either increased or stabilized with regards to COVID patients. And then lastly, I believe fire department, I don't know if police department they all have minimum staffing requirements, right? So even if you have a crew out, a whole fire station potentially out on COVID quarantine, it doesn't mean you close the fire station down, right? You have to still fill those roles. You have to hire an ambulance, you have to hire the crews for a fire engine, and that's where some of the increased cost is coming from. Is that correct?
Mr. Mayor, Councilor Rivera, yes, that's where calling in different employees to cover those shifts would result in overtime potentially for those employees.
Yeah, and potentially if you go pick up a patient that has a positive result, that could be as high as five employees from one fire station, correct?
Yes,
Potentially more.
that's correct.
Yeah. All right. That's I agree with what you're doing, whether we do it for 6 months or a year. I think we could always revisit it if we don't decide to come back in June. I think we can revisit it at any time, but I do agree with the changes. Thank you, Mr. Mayor.
Thank you, Counselor. And Counselor Michael Garcia, you have the floor.
Thank you, Mr. Mayor. I just want to echo the same sentiments my colleagues had mentioned earlier in regards to providing the appropriate systems and tools to encourage our fellow Santa Fe, City of Santa Fe team members to get vaccinated. I think that's one of the best ways for us as a community to stay safe. I do have some questions in regards to the FIR. I think I read that the FIR was based off of an average of 20 cases per month. And if my counting was correct, for the month of December, we had, I think it was 56 or 57 cases, which is nearly triple used to estimate these costs, which if that stayed consistent, that would be a 6-figure number, $120 $20,000 versus the $40,000, which is in the FIR, which is a significant difference in funding that would be necessary. And, with the factors that we're seeing right now with, the rise in cases due to Omicron, I think we really need to reevaluate the numbers. We need to be able to provide the appropriate resources should we want to provide this benefit to employees. And I think it's better for us to use more recent numbers, even if it's November, December, just because the explosion right now we're seeing in cases, and it's not likely to go away. It's only, the statistics and data shows it's only going to get worse for the immediate future. And so with that, I think I'd like for the numbers to be revised and with the most recent data that we have, as I mentioned, with December being nearly triple what the data was used to estimate these costs. That way we're not coming back and having to reallocate resources. I'm also in favor of looking at this within 6 months. This virus is continually changing. If we remember where we were 6 months ago, I mean, we all thought we were out of the woods in some sense and we were getting better. And then Delta hit us. It knocked us on the ground. We started to pick ourselves up from that. And now Omicron has just put us back on our back. And we need to be able to be flexible and not have the 1 year commitment to this. I think who knows where we're going to be in 6 months, honestly. And we need to be able to provide that flexibility. And I would even say, let's look at a quarterly update on this. We might have folks that might have 3 exposures. I mean, especially when you're talking about folks that deal with the public, like our police officers, our fire, our alternative response unit folks. We need to be able to provide them the tools that allow them to continue to provide the critical services to our community. With that, I don't know if we're ready for a motion. I think this needs to be postponed until next week to get the appropriate data updates. That way we can, as a council, commit or make it the appropriate decision on what we're going to be committing to. So with that, I don't know if I can make a motion to postpone a decision on this until our January 12th council meeting.
There is no motion on the floor, so I'm happy to entertain a motion and we can discuss or vote on whatever the motion is.
Okay, so then go ahead.
I thought that was your motion, Councilor Garcia.
Yes. Motion to postpone until our January 12th meeting.
Second.
So there's a motion from Councilor Michael Garcia to postpone this matter till the 12th and a second from Councilwoman Villarreal. Is there discussion? I just want to be clear, Director Salazar, between now and the 12th, on the questions that have been raised about the existing policy, the number of hours, the incentives or lack thereof for vaccination, the current policy will stay in place, which is simply the one that's stated in this resolution. The only thing the resolution changes is the paperwork process, not the policy.
Mr. Mayor, yes, that's correct. So everything will essentially remain the same. It'll just be done the way it is being done now, probably not as efficient as we can be doing it now.
The city attorney's hand is up.
Mayor Weber, councilors, I would like to clarify that the existing administrative leave is essentially discretionary. It doesn't specify a number of hours, and I think most requests have been approved. This does establish a specific number of hours, which I think does incentivize vaccinated persons, or at least provides them a better situation because they're less likely to be required to isolate or quarantine. So there is a bit of a difference. And then any additional administrative leave would be discretionary beyond those hours. This would guarantee a certain amount of hours for all employees.
Thank you. Any other comments or questions? I'm Councilor Garcia, you're Michael Garcia, your hand's still up. Is that to speak or just it's the old hand?
Sorry, Mr. Mayor, that was an old hand.
Okay. I didn't want to overlook it. I'm up. We have a new hand from Councilor Lee Garcia. You have the floor, Councilor Lee Garcia.
Thank you, Mayor. I just had one last question in regards to all the public safety. I wrote down that it's the firefighters, but how is the police department being addressed with this as well? Do they fall under public safety with the firefighters?
Mr. Mayor, Councilor Lee Garcia, yes, they are public safety and they would be, it would apply the same.
Thank you.
Thank you, Counselor. Anyone else? Having listened to the questions, I'm perfectly happy to revisit this in 6 months. I think that's a reasonable observation, given the changes that we're witnessing. The question about 10 days, 5 days, that change, in fact, came recently and is not universally being hailed as a good move. I think from some quarters, the criticism has been made that the shift from 10 to 5 is less about science and more about workforce availability. And I know that other countries have rejected the CDC's guideline as not in their best interest. So it's not, this is a moving target. There's very little total certainty that we can claim on any front. I think the major shift that the Director Salazar is recommending has less to do with policy and more to do with ease of processing what we all agree is a challenge to our workforce, our managers, and the system of keeping track that falls to our HR department and is a very burdensome paperwork task. If we'd like to take it up in 6 months and revisit the utilization of the resource, I'm comfortable with that as well. I just think I'm not sure exactly what additional data will tell us about whether or not the paperwork change is going to make a big difference in the overall policy. Councilwoman Villarreal, you have the floor.
Thank you, Mr. Mayor. I think the data for me would help so we can determine if that's enough or sufficient hours based on the trends that we saw last year. I know things are shifting a little bit, but what I wanted to see is, are these hours enough? And then I do agree that 6 months could be the time frame, just because there may be things that shift with the variant. So that was, for me, it was just helpful to kind of see what the trends were from last year. And then if that incentive piece, what can we do if there's any incentive aspects to this? I'm not sure if there will be, but that's what I was really wanting to see. And the data that we talked about, how many times people were exposed, if it was more than once. So I think it's more just like making sure those hours are sufficient for our employees. Thank you.
It is interesting, just to take the floor one more time before I recognize Councilor Romero-Worth. We were speculating about how long the current Omicron spike will last and what will happen. And here again, there's no certainty. We've seen South Africa have its profile change dramatically from when Omicron first hit to a fairly interesting lowering of cases. There's speculation, and I don't have a degree in science. I'm not even as qualified by any stretch as Councilor Cassett with public health, but there is some speculation that the spike we're seeing with Omicron will potentially go down relatively quickly, as it has in South Africa. If that were to be the case, then a 6-month review would certainly be well warranted, so we would know more about how Omicron and other variants are affecting our workforce and the people of the city. Councilor Romero-Worth, you have the floor.
Thank you, Mayor. So any leave that is granted between now and the 12th, could that, and if, let's say, we stick with this 80 hours or the way the structure is laid out, it could be anybody who got leave between now and then, it could be against this 80 if we ultimately approve it? Or is it anything we grant going to start when we actually approve it?
Director Salazar, can you help us with that?
Mr. Mayor, Councilor Romero-Worth, I think it will depend how we craft the language with any additions to the resolution. the intent of this one would be starting from this point forward if it was approved. So if we were going to say we're going to deduct it if you receive leave from January 3rd through the 12th, then we would have to build that in. I don't know if Erin has anything else she'd like to.
No. Mayor Weber, Councilor Merworth, I think we would have to apply the existing personnel rule because it is in place currently. So generally, so employee rights to leave would have to be based on the rule that was in place at the time. I guess if we're giving additional benefit, so if we're retroactively applying a higher benefit, then that's probably fine. But if we're going to deduct from something we're giving to other people prospectively, I recommend against that. So I would not recommend that we reduce the number of hours provided to city employees if something happens before the rule is placed in effect, if that makes sense.
But that's not what we'd be doing, right? Because we're going to be giving them 80 hours, which they don't currently have set in stone.
Mayor Weber, Councilor Merworth, if we were to reduce certain employees 80 hours starting on a certain date as compared to other employees, then that would be giving them less of a benefit.
Okay. It's one of those glass full, glass half empty kinds of questions. All right, that's all I have. Thank you.
Thank you. Director Salazar, your hand was up on a different matter and I didn't recognize you. Did you want to speak to something?
Yes, real quick, Mr. Mayor, on the point regarding people who are needing to request leave more than once. I would just want to put a reminder out there of what our current quarantine policy is. So if you are fully vaccinated and you're identified as a close contact and you don't have any symptoms, you're not required to quarantine. The people who are not vaccinated and are a close contact, regardless of symptoms or not, are required to quarantine. So some of the people who are requesting leave multiple times are likely the ones that are not vaccinated. So I just wanted to make sure that that rule is clear, and that's likely what we're going to see when we produce the statistics for you.
Thanks for the clarification. Other questions or discussion? There is a motion on the table to postpone this item until the meeting on the 12th. If there are no other comments, could we please call the roll?
Yes. Counselor Michael Garcia,
Yes.
Counselor Lindell,
Yes.
Counselor Rivera,
No, I'm fine with it as written.
Counselor Romero Worth,
I don't know what to do. I could argue this both ways. No.
Councilwoman Villarreal,
Yes.
Mayor Weber,
No.
Counselor Cassett,
Yes.
Counselor Chavez,
No, I think the focus of a change in process would create ease for employees and HR.
Counselor Lee Garcia,
Vote yes to postpone.
motion passes.
Very good. Just to look around on the Hollywood squares, everybody's name was called. Am I correct? Everybody got a vote on this one? Okay, fair enough. Thank you. In that case, we will take it back up on the 12th according to the motion. And there is no other business before this meeting, and we are adjourned. Thanks, everybody.